So I'm Giselle Tan. I wanted to talk about sort of kind of more common foot and ankle problems. And so it's kind of geared for lots of different topics. And so if you've got a question, feel free to ask me at the end. Okay. And so we're going to go through the anatomy of the foot and ankle. We're going to go through the motion of the foot and ankle, and then we're going to go through common problems. The foot's actually broken down into three parts. One is the forefoot, and that's the front part of the foot. And the most common problems there are bunions or great toe arthritis. And those are two totally different things, okay? And then there's the middle part of the foot, and there's a lot of injuries that cause eventually arthritis. And then the back part of the foot, or the hind foot, that's where you get a lot of the alignment problems. And we're going to go through each one of these things and go through kind of treatment options, both conservative as well as operative. Okay, so that's going to be the outline of the talk. And so the anatomy of the foot and ankle is actually, this. This is an x-ray of a normal foot with all the normal bones. And some of them are listed here. The ankle itself is made out of the big tibia bone, the fibula bone, which is the bones on the top there. But this part here is called the forefoot. And that's everything from, the metatarsals, or it's the same thing as the knuckles of your toes on south. And then this part here is the middle part of your foot, so that makes sense that you call it the midfoot, and all the joints that are just right there. And then obviously back here is what we call the hind foot. This here is the ankle. And if you look at this x-ray, everything in the body is actually smooth, okay? Every bone that you see here is smooth, so even though they're irregularly shaped, they're actually all very smooth. This ankle joint is smooth. All of these joints here are very smooth. So even though this bone is oddly shaped, it's also smooth, and all these joints are very smooth, okay? I can actually kind of just draw right down here that this is completely smooth. So smooth is normal in the body, so I just wanted to point that out. And this is a picture kind of straight on of the foot. And if you notice that there's actually two bonus little bones that the big toe has, these guys here. They're called sesamoids. It's almost like the kneecap to the big toe. And so I'll go back. And you can see that normally no other toe has that, okay? And again, everything is smooth. There's nothing rough about any of us. We don't have any angles in our body, okay? And so just going through, what the foot can do. And so the foot, believe it or not, is not just flat on the ground, okay? And so the angle of the motion is actually 41 degrees from the ground. And so that's that big dark line where it says axis of that subtalar joint. That's the part of the hind foot, or the joints close to the ankle. And believe it or not, I don't know if the thing needs to be moved. But it's actually also not just straight on either, because believe it or not, the way the foot moves is not just straight up and down. It's actually also angled 23 degrees towards the big toe, okay? And what are we basing that off? It's actually this motion right here, okay? Because that motion really goes through from the heel all the way down over here, okay? And so that'll be clear here in a moment, okay? So the average motion of the foot in sort of side to side is 5 degrees of eversion, that's this motion, and then 20 degrees of inversion, which is this, okay? And so what are the motions of the foot? And so believe it or not, so the foot can actually go up and down. That's called dorsiflexion. This is just a side view of that. It goes up, and that's called dorsiflexion of the whole foot. And the ankle also moves up and down, but also the joints of the foot do that as well. And this is called plantar flexion, and that's when the foot actually hits the ground. So you can imagine plantar going to the ground. Okay, so those are the motions of both the foot and the ankle. And believe it or not, this is actually kind of a little bit of a busy picture. But the thing that I want you guys to take away is that 60% of the time your foot's on the ground. Okay, The other 40%, that foot's swinging to get to the next part of the ground. So most of the time, even when you walk, greater than 50%, it's not a 50-50, 60% of the time your foot is on the ground as you walk, okay? And so that's really important. And so believe it or not, we're going to illustrate here a little video. Hopefully it moves. Oops. Here it is. And so believe it or not, the stance phase is when the heel hits the ground. And believe it or not, there's several muscles that control your foot just not slapping on the ground. And that's actually the muscles in front of your ankle. And it actually has to contract as it's getting longer, and that's eccentric contraction, so that your foot doesn't slap on the ground. But when your foot's flat, it actually makes sure that it stays flat. And so the muscles in the back of your leg, your calf, has to contract. And then when your foot comes off the ground, then that's when the muscles have to contract. And so this thing here illustrates the fact that your alignment has to go through the ball of your hip all the way down your tibia and actually down the hind foot, because that's actually the big motion that actually propels us to walk, okay? And so I want to go through a little bit of anatomy with these joints in the back of the foot, okay? And there must be some sort of technical difficulty here. This is a joint here called the talonavicular joint, and this is called the calcaneocuboid joint, okay? And believe it or not, when the foot hits the ground, they're parallel. And that way it's flexible, so you can actually accommodate the ground, okay? So these two joints help accommodate the ground. That means uneven surfaces, be it leaves or gravel or anything like that. And like I said, we're having a little bit technical difficulty, but this other picture, and I can show this to you guys later, when the foot comes off the ground, those two joints are not parallel, making the foot rigid when it comes off the ground. That way it comes off in one sort of lever, okay? And so common problems in the front part of the foot are bunions, or what we call medically hallux valgus, okay? And it's used to describe lateral deviation of the great toe. What does that mean, okay? This is, believe it or not, a normal x-ray. And so you can see that normally this big toe should point, this bone here should point towards the big toe. That makes sense because all these ones here point towards each one of these toes. And normal is actually about a 10-degree difference in between. You can have a little bit of deviation. That's still normal. And these are those little sesamoid bones, okay? And believe it or not, those sesamoid bones aren't just hanging out there, doing nothing. They actually have extra muscles, okay? And so believe it or not, they never move, okay? This is actually a bunion, okay? And if you notice that there would be a bump of bone right here, okay? And these little bones right here always stay where they are because there's actually muscles attached to them. And so these never move. And so you can imagine that this and this don't look the same. And so if we move this bone over here, that's where it should be, okay? And because they're muscles that attach to these bones, it actually predictably makes the big toe snuggle next to the second toe, okay? That's just the way the muscles are, okay? And so this is just a picture overlaid, and that's really what a true bunion is. People have rubbing here in their shoe, because you can imagine shoes are made for feet that are totally straight, just like this one. They are not accommodative for any sort of abnormality, especially since we buy them all off the shelf now, okay? And so who gets bunions? Both men and women get bunions, and women are typically more symptomatic. Why is that? You can look at the shoes here. The one on the far left is a woman's shoe. That is not going to fit a man. And you can see as they go to the right, those are more kind of man shoes. And so, if you kind of do this, that's not really going to fit, is it? That fits a lot better. But you can imagine as you get, wider and wider, and women's shoes don't come in extra, extra wide like men's do. And so men can get them. They just don't complain because their shoes are big enough to accommodate it, okay? And so what can we do about bunions? Obviously, we want to make sure that shoes don't squish your feet. And so, like I said, everything sort of shifted over. But you know, you want to make sure that shoes actually have what's called a wide toe box to accommodate, you know, so you don't have this kind of squishing thing going on, okay? You know, other options, obviously a shoe stretcher. When there used to be shoe repair people, this is what they would use to stretch your shoe. And obviously you can imagine that that stretches obviously this part of your the shoe. And obviously this is, you know, that's what you do. You actually just kind of turn it and you leave it there and it stretches all the leather. You know, the other option obviously is to cushion that, okay? And that's sort of the conservative treatment. And really you don't want to do a whole lot other than that unless you can't find a shoe that really you can fit in anymore, or it hurts despite not having a shoe, okay? And so what do we do operatively? We actually realign the bone and the soft tissue. So this is actually a patient of mine. She had something done with her right foot in the past, and so she's here to see me for the left, okay? And you can see that this one on the right, you can still see that thing here is still deviating over here, okay? I can't remember how long ago that was. And so this is what I did. She's a year out now. And so this is what I do. I actually fuse the joint down here to get a normal alignment of the bones here. And you can see those two little bones are exactly where they should be. And this toe is exactly where it should be. Okay? And like I said, you can see that to that. So another thing of the front part of the foot is called Hallux rigidus. And that's just a fancy term for arthritis of the big toe at the joint. Okay? And this is the picture of a normal foot. Remember I said to you, in the body, smooth is normal. You see how smooth these joints are? They're perfectly round. In fact, these joints, even though they undulate, they're perfectly round. And so smooth is normal, okay? And so arthritis, that's how we actually define arthritis as less motion of the joint, okay? And it could be traumatic or degenerative. Okay, and that's normal. And obviously this is the running of the bulls. You see someone's being stepped on. The back of the bull there is stepping on someone's foot. And so obviously you can get stepped on with a horse or a cow or lots of things get, you know, everything happens to the front, the front part of the foot or the dorsum of the foot. And so you can have this, okay? And you can see that they're two totally different x-rays, okay? And believe it or not, arthritis, the easiest way to describe arthritis is when the cartilage wears out, arthritis happens, okay? And arthritis typically has what's called these bone spurs. And you can see that that's not smooth. Remember I said smooth is normal. That is not smooth. That looks like a little shark fin. Bone spurs happen because cartilage that is normal, which is smooth over here, has no nerve endings. Once the cartilage is worn out, the bone gets exposed. And then the bones have nerve endings. That's why you know if something's broken, because those nerve endings normally don't fire. So when those nerve endings get exposed because the cartilage is worn down, your body says, I don't like them being, I don't like those two things touching. So I'm going to try and make this thing stiff so this person doesn't move it. And so it grows these bone spurs, okay? That's your body's way of trying to protect it from not moving, okay? And bone, that's all it can do. It's not particularly smart. All bone can do is grow more bone, be it arthritis, be it a broken bone, be it a tumor, okay? That's all it can really do. It can just grow more bone. And so believe it or not, like I said, that is not normal. And so this is actually arthritis of the big toe. You notice, unlike the bunion, the bump is on the top, okay? The bump is truly on the top. It's not on the side, okay? And so you can imagine that, obviously, that has got arthritis on both the inside and outside part of your toe. And so what can we do about this? One is to actually stiffen your shoe, okay? This thing is a carbon fiber insert, and it's called a Morton's extension. It goes towards the big toe. It's meant to be worn underneath something that's soft and squishy, because you don't want this thing touching your foot. It's actually as stiff as a board, but pretty thin as a couple pieces of paper. And so this is that same picture, and you can imagine if you put that in your shoe, that doesn't allow that joint to move, okay? So what else can we do? One, we can actually remove that bump of bone. And so you can see that that's the picture that we saw on the right, and that's actually the bump of bone removed, okay? And believe it or not, sometimes the arthritis is bad enough that we can't just remove the bone spurs. It may require a fusion. So this is someone here who has arthritis of the big toe. But the big thing I want you to notice is her arthritis is also in the center. You see how the center of the bone is touching the center of the bone? So for her, it hurt. It didn't matter if it didn't move. It hurt all the time. And so for her, I offered this fusion, okay? And so she's very happy. She walks all day long. She's on her feet all day long, and so she's pretty happy with this. And so I get a lot of people also saying, well, if you fuse that, does that mean I can't walk, I can't do things? Of course not. Because believe it or not, I guarantee this thing doesn't move, because there's no space for it to move, okay? So if it doesn't move, I guarantee that you're not, you know, just sitting in a wheelchair. You're certainly able to walk, but you do this for pain. So you can walk and you can, you know, play golf, you can garden, you can do all these things, okay? And so we're going to go now to the middle part of your foot, okay? So the most common cause is actually prior trauma to the midfoot. That's the middle part of the foot. And so a lot of people say, you know what, I had a foot sprain. There was bruising. There's a lot of bruising. You can see here that there's bruising on the bottom of the foot. And that's actually very unusual to have bruising on the bottom of the foot, because just like the palm, the soles of your feet have very different structures. So for you to have bleeding that goes beyond those structures is actually it's a much bigger injury than you would think. And normally people say, you know, it took a few months to feel better, but it did feel better. But like I said, that bruising is just not normal. And people always say, you know, my doctor took x-rays and they said it was normal, I didn't see anything, okay? And so believe it or not, the most common mechanism is actually when you miss a step, okay? And you can imagine when you miss a step, you're trying, you know, you still have your foot down, but then your weight is on your leg. So it actually buckles things in the middle part of your foot, okay? And so it also can be a sports injury. You know, this is just football here, and you can see how someone falling on a foot, a lot like this one right here, where it's already flexed, can cause the same injury, okay? And so believe it or not, let's see if this will play. This is actually a football quarterback named Matt Schaub. He no longer plays because he had a couple of bad seasons. But anyway, he had a Lisfranc injury. So he's tackled from behind, and he's trying to run away from them. And so it happens in professional sports as well, okay? So what is the Lisfranc ligament? And who is Lisfranc? Lisfranc was actually a general in Napoleon's army. Napoleon's army, I don't know if you guys know history, he marched everywhere. And he marched long distances and really fast. And so a lot of people had foot pain because they were marching, 100 miles a day, with all their packs and all their stuff, and they were carrying their cannons and all that stuff. And so that's why it's called the Lisfranc, because a lot of those foot soldiers just had this problem, okay? And obviously they couldn't walk anymore, and so they got left behind, and I don't know what happened to them. They probably didn't feel great. Anyway, this is the Lisfranc ligament, okay? And it actually connects the second metatarsal, or that's the bone that leads up to your knuckle, to the first ray, okay? And believe it or not, just like the thumb, the big toe and the thumb are very similar. And so you can't actually have your thumb tethered just like your hand over here and expect it to work like a thumb. You can't have it tethered here. So just like the big toe and just like the thumb, the tethering is way over here, okay? And that makes sense. And so you can't have just the tethering here like you would have with all these other small toes. If you tethered this here, the big toe couldn't do what it needs to do. So the tethering of this toe happens at the base of this toe and this bone here. So there's no true connection here, okay? And so believe it or not, there's 3 parts to this Lisfranc. There's that one there, and that's the one on the top. There's this one here. It's actually in the bone. Do you see that? And this is truly the Lisfranc ligament. Okay? It actually connects bone to bone. Okay? And this one's the plantar ligament here, and actually inserts into the second, third, and then this we call this a medial cuneiform. Okay? And so that's what it actually is. Okay? And so there's again that bruising on the bottom part of your foot. Like I said, it's unusual to have bruising on the sole of your foot. And you can see that people typically say, you know, it hurts right here in the middle part of my foot, okay? And so usually it hurts to walk. You have a lot of bruising, and you have a lot of swelling. You can see the swelling difference between this person's left leg and right leg, and their x-rays were normal, okay? You need to have x-rays where someone is standing, okay? And so why is that? Okay, I'm going to show you. This is a normal foot, okay, other than a little bit of arthritis in the big toe. It has to be standing because they're actual normal things that we look for as orthopedic surgeons. The alignment of certain bones of the second toe and then that other bone right there has to be in line, okay? And it actually the space has to be equal between those 2 bones. And you can only do that when someone is standing, okay? And so this is how subtle it is, okay? So this is the normal side here on the left and the abnormal on the right. Look at the difference. You see how different, you see on the right, it just is a little subtle discontinuity. This is a Lisfranc injury. Look at the normal one on the left. Very, very subtle, okay? And believe it or not, what do we do for this, okay? We actually recommend that this get fixed, okay? You see this here, okay? You see the subtle difference. You're like, I don't see anything different. But this is subtle enough, like I said, just because I know what I'm looking for, that there is something wrong with this, okay? And so believe it or not, we fix it, okay? And what I do is I fuse it. I offer people, we can fix it or we can fuse it. Even when you fix it, there's still a 50% chance that it can get arthritic in the future, okay? And so this is someone that I actually fixed. This person, you know, works on a ranch and is obviously pounding on this all day long. And believe it or not, the natural, why do we even care about this? Because we know that the natural history of a missed injury is arthritis in the future, okay? That arrow there is actually showing that that's not a normal alignment of these bones. There's normally, I told you, smooth is normal in the body, and this is not particularly smooth, okay? You see that this gap's here, and that's, you know, this whole thing is not smooth. And you can see here, these joints are not smooth. And so that's actually arthritis. This is someone who came to me to say, you know what, I don't remember doing anything, but I was told I sprained my foot, and, you know, it was fine after a couple months. And so you can actually see here, this is just rolling their foot in a little bit. And you can see how irregular this is. I told you smooth is normal in the body, okay? That's not particularly smooth, okay? And you can see there's actually a little bit of arthritis right here, okay? That's not supposed to be there. There isn't supposed to be bone in between there, okay? So what I did for this person who, you know, is older is did the same thing. I fused her foot, okay? And so why do I offer fusions? Because if it doesn't move, it shouldn't hurt, okay? And these bones are odd enough that there's no replacing these joints, okay? And so just going through the anatomy again, we're going to go through now the back part of the foot, okay, this hind foot. And so this part of the talk is a little bit different because we're going to talk about actually the alignment of someone standing, okay? This is actually someone who's pretty young, healthy, and these are their feet, okay? They're very active, and I want you to look at this x-ray here, okay? she's actually lined up her feet with these lines. And you can see her heels peeking out from the front. Do you see that? That's not normal, okay? And she's also had recurrent sprains, okay? That's not normal. Normally someone's heel is behind their leg, okay? And so she has pain on the outside. And this is a picture. Typically, we don't see this big hole in between these two bones. And this is the arch is between the big toe and the small toe. So she's got a really high arch. This is a hallmark of a high arch, is someone's heels peeking out, with you looking at them from the front, okay? And so this is another x-ray finding, okay? The normal foot here is on the right, okay? And so you can see how I can draw a straight line all the way down. It hits the middle part of the heel and the fat pad and down the leg. This is that same person looking at them from behind. So you can actually see how it actually does not line up the same, okay? And believe it or not, these are some ligaments on the side here, and so we'll go through. And you can imagine if you're out rolling your foot, and that's really what they're doing, is they're rolling their foot or trying to sprain their foot, things on the outside are the ones that will be irritated, okay? And so this is actually a normal x-ray, and you can actually see that there's normal space in between the two corners of the ankle joint, okay? The ankle joint's between the tibia and the talus there. And there's a mild overlap of the tibia and the fibula. This is that same person, and believe it or not, well, you would see it, it's on the other side, but you can actually see how this is 100% overlapped with this bone here versus this over here, okay? The joint is still, okay, but you can see it doesn't look quite the same, does it? Okay? And so, like I said, normally the fibula bone and the tibia bone are really hiding behind one another. And this is the same person, like I said, it's just off to the screen here. And so what are the structures on the outside part? It's the balance muscles over here, and that allows for your foot to go out, 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 okay? That's its job. And so this is actually someone who is walking. Let's see if I can play this. And you can imagine that is not a pleasant way to walk, okay? And they have calluses on the outside part of their foot, you can imagine. And believe it or not, this is someone, I showed you that one picture about unlocking the foot and locking the foot when you take your foot off and when you put your foot back down. They cannot unlock their foot because of their alignment. And so their foot is rigid all the time. So they can't actually put the rest of their foot on the ground because of their anatomy, okay? And that's just, you know, you can actually see here that, you know, those dots aren't really in a line, okay? And this is actually a little board where you can actually test someone, and what you do is you drop the big toe down the board, and it actually lines up the rest of their foot. And so believe it or not, the big problem with these people is the big toe drives in the ground, okay? And I'll show you that here in a minute. This is actually inherited. So if someone in your family has high arches, you're more likely to also have high arches, okay? Just like people with flat feet, you can have flat feet because you've got only two people to blame, okay? And so, like I said, it can be part of a genetic disease as well. This is a whole family of people that have the same thing, okay? And believe it or not, there's really a true genetic test where it's actually a problem with one of the covering around the nerves. That's called myelin. And normally it happens pretty young, okay? And you test for it with the nerve conduction study. And there's also a DNA test for this, okay? Common symptoms, this is someone who's totally worn out the outside part of their foot, okay? And usually I see people, oh, I bought this shoe, you know, a month ago, and it looks just like this, okay? And that's not normal. You have calluses believe it or not, on the top of your foot as well as on the big toe. You can see how high this arch is, okay? And believe it or not, you can have stress fractures because you're on the outside part of your foot. And you also have pain in the heel and this big toe because they're just pushed into the ground, okay? And that's normally, if you have one of these little, foot pressure sensors, that's how they stand, okay? It's all off to the side. Again, that's that same family. And you see these recurrent sprains and then instability happens, okay? And like I said, this is just not a normal x-ray with nearly 100% overlap of the big tibia bone and the little fibula bone, okay? And so recurrent ankle sprains may lead to instability. These are my fingers here, and I should not be able to do that to someone's ankle. This is someone standing. This is me just putting my hand up here and over here, and you can see how this is not smooth, nor is it normal, okay? And so, after long-standing problems with this, you can also have arthritis, okay? And that's this is the normal side. See how that's smooth? And this is just abnormal, okay? And so obviously that's what we're trying to prevent is this kind of end-stage problem, okay? And so the conservative treatment is actually to have this insert where you actually have the big toe kind of drop down, okay? And in fact, what you do is you actually roll their foot to the inside to try and get more of their foot to touch the ground, okay? And that's, that's this insert with the little hole for the big toe, and then we put a little wedge so it rolls them to the inside, okay? And obviously you can have braces and things like that, and obviously if they have these kind of toes that kind of claw, you need to have a wide shoe to prevent the rubbing there, okay? And again, that's that same picture where if you drop the toes down, it actually realigns the heel, okay? So this is just a problem because of an alignment problem, okay? So this is actually, again, abnormal. You can see how this and this are not symmetric, okay? And so you have to correct the deforming force. And again, that's the same thing. This is my patient. That's them. And so this is me actually trying to realign the heel bone, okay? Realign the heel bone as well as tighten the ligaments. And it's the ligaments on the outside part of their ankle, okay? And you actually, you really make it stiff, okay? And so this is the same person. Those are my hands. And you can see how that just does not move, okay? Versus my hands over here. Okay, that's me. Oops. Versus this, okay? And that's to try and prevent arthritis in the future. So this is the same person. They're about a year out, and you can see the tibia bone and the fibula bone are pretty well aligned. What I did is I cut their heel bone and moved it to the outside, actually. And so I need to do that as well as this tightening of the ligaments, okay? And so from this to that, okay? The goal is to try to obviously prevent the arthritis. Once the joint is arthritic, we can always do injections, we can do bracing, okay? So this is the other extreme of what can go on in the back part of your foot. So this is someone, that's actually their initials, which I thought was kind of funny because they do have flat feet. And so this is someone who's 60, feels the foot is getting flatter and it's getting weak, and their pain is in the arch as well as the outside part of the ankle, okay? The outside part of the ankle is here, okay? And so this is their x-ray, and you can see, I told you that the arch is between the big toe and the small toe, and they're perfectly in one line. Okay, so there is no arch on this person. That's, again, a normal foot. And that's someone who can go up on their tiptoes. And believe it or not, going up on your tiptoes recreates this arch. Okay, do you see that? Okay. And so this is the anatomy of the inside part of the foot, just kind of overlaid with that. And believe it or not, this is your arch muscle right here, okay? This is your arch muscle that allows you to go up on your tiptoes, okay? And so this is very common. Sometimes it can be congenital. Usually it's acquired. And so this is actually someone, you can see that their foot is very flat, okay? You can see that, you know, their heel is kicked out to the side. They're putting a lot of pressure on the inside over here. And believe it or not, what's happening is because the arch muscle, which is on the inside, okay? If you go back here, that's this arch muscle, which is on the inside, lives right here, okay? And if that stops working, everything on the inside part of the foot starts to stretch out, okay? And again, usually what happens is you have what's called this hindfoot valgus. So if you draw a line, this heel kicks out, okay? And believe it or not, this is a true medical term, it results in too many toes peeking out in the back. So it truly is called too many toes sign, okay? And that's a real medical term, okay? And you can see how that is not in one line, okay? And so believe it or not, what happens as opposed to with the person with the high arch, this hind foot can't possibly get stiff. So when it comes off the ground and hits the ground, it just basically collapses because it actually cannot lock the hind foot, okay? And so it's really kind of a loose foot, okay? Because you can't push off because it can't be rigid because the structures on the inside have failed, okay? And so again, what you see is actually this talus bone, okay, is pointing towards the ground. And that's not normal. Normally it should point towards your big toe, okay? And believe it or not, what do we do with flat feet? Obviously arch support, okay? About a third of the people on earth have flat feet, okay? And that's why you can't use flat feet to be out of the military because there's too many of them. And obviously a third of the people on earth don't need orthotics, okay? That would be too many orthotics. And so for someone who's symptomatic, obviously an arch support makes sense. If you notice in this arch support, this actually has some sort of supports, unlike a Dr. Scholl insert, okay? And what you want to do is to post it on the inside to provide some soft tissue support for the inside part of your foot, okay? It supports also obviously the middle part of the foot, okay? And you can see how that fits pretty nicely, okay? So what do we do surgically for flat foot correction? The point is to try and restore the mechanics and stabilize the arch. You need to have also dynamic muscular control of the arch and realign the heel under the foot, okay? So this thing here, I want to show you that this, if I draw a line in the middle of this bone, I should hit my big toe, and it doesn't. It hits over here in left field. It's the same thing on this side over here, okay? So this person just has a normal flat foot. They don't have arthritis. There isn't anything wrong with these bones of their foot or in their front part of the foot. They don't have a bunion or anything like that. And so they have a flat foot. So this is actually someone that, these are her x-rays. Her right foot, you know, it hurt. Shoes, no shoes, it hurt all the time, every day. And so I said, well, I can do all of these things. And so this is what I offered her. I actually stabilized the arch. Believe it or not, the arch is right here, okay? So I fused this joint and fused these two bones here, okay? And what I did also is I realigned her heel bone, which was kicked out to the outside, and then moved it to the inside. So it's actually underneath her leg bone here. What I also did was I actually took her toe tendon, which curls your toes, and moved that to become her arch muscle, okay? This lady is 9 months out. These are actually her true x-rays. If you look at this versus that, you can see how this one here, that thing there, points not too bad towards the big toe, okay? And like I said, that's her side x-ray. So kind of going back, the function of the foot relies on a lot of different joints, all having to be properly aligned to have normal motion of the foot, okay? So problems can arise with abnormalities in the front part of the foot, be it a bunion or arthritis in the big toe, okay? They can also arise with problems in the midfoot, okay? And like I said, this is arthritis over here, and this is actually, that subtle difference between the two, okay? And also problems can happen depending on the alignment of the back part of your foot. This is that one person with the high arches with the recurrent sprains. This is the person with the flat foot, okay? It still affects the back part of the foot, but they're just kind of opposite, okay? And the goal of treatment for all these problems is to improve the function and the ability to walk. We always try to treat everything conservative, and it may require surgical intervention, okay? And that's actually that same person with the flat foot, okay? But it's actually rare for me to offer someone if they've not tried any of these other things, okay? So thank you very much for coming.